All right, it looks like we're at the top of the hour. So hello, everyone, and welcome to part 2 of our webinar series, Community Health Dashboards, Bringing Your Assessment and Plan to Life. My name is Zach Flores. I'm a project coordinator here at HCI, and I will be your facilitator this afternoon. I know we have a very limited amount of time together, and we have so much information to share with you all. So I'll get right on into it with just a couple of housekeeping items. You've all joined this event as an attendee. So you're all automatically muted for the duration of the webinar. But if you have any questions as our presenters go through their slides, please feel free to type them in the bottom right-hand box of your WebEx window. I'll be monitoring your questions as they come in, but please make sure to select the All Panelists box when submitting them. It looks like we have a good-sized group today with over 100 attendees, so we're really excited to see what questions you all have for us. In addition to our speakers, we also have some additional HCI team members who are supporting the webinar as panelists, and we'll try to answer as many questions as we can throughout the presentation, but we'll make sure to bring them up during our Q&A session. And I wanted to make one final note that there will be a recording of today's presentation made available to you all following today's webinar. So as I mentioned before, my name is Zach Flores. I'll be playing the facilitator role, and now I have the presenter of introducing our two presenters for today. First off, we have Jane Chai, our community health subject matter expert. Jane has worked in the community health field for the past 20 years. Prior to joining the HCI team, Jane worked at the local health department in Orange County, California for 15 years and was responsible for coordinating community health planning, strategic planning, workforce development, and quality improvement. Next up, we have Emily Hummel. She is a senior account manager on our client services team here at HCI. She has her master's in public health and has been with HCI for over 5 years. During that time, she has worked with a variety of clients all across the country to build and implement their community platforms, as well as working to improve their community needs process assessments, strategy planning, and progress tracking. We're very lucky to have both Emily and Jane here on the team, and as well as speakers for today's webinar. Now that we've introduced ourselves, at this point, we'll be turning off our webcams in order to maximize the audio quality for the remainder of the presentation. So for those of you who may not be, who aren't familiar with who we are, HCI has been a leader in the community health field, for over 12 years. We've conducted over 200 community health assessments and implementation strategies with partners all across the country. We also provide strategic direction for community health initiatives, and we're known for our award-winning customized technology platforms. Along with our powerful analytical tools, our platforms provide access to continuously updated population health and socioeconomic data to help tell your community story. Like Jane and Emily, HCI's employees bring both a combination of advanced public health degrees and real-life experience in community benefit and population health. So next up, I just wanted to note that today is the second part of our webinar series, Conducting Assessments During Uncertain Times. Part 1 of the series was conducted last week and shared some emerging trends and best practices when completing your CHA or CHNA. Today, however, we'll be focusing on how to ensure that your assessment is a living document that engages community partners and leads to shared action. And later in our final installment of the webinar series, we'll be discussing how to both implement as well as track your community health strategies. And so with that, I'll pass this over to Jane to take a deeper dive into the objectives for today.
Thank you so much, Zach. As Zach mentioned, we completed part 1 of our webinar series last week, and we'd like to build on that today by sharing how you might use a community health dashboard to bring your assessment and plan to life. We'll be covering ways to use your dashboard to tell your community story with meaningful data that help identify local priorities and health disparities, use local data and resources to enhance your assessment and plan, and utilize findings to engage community partners in cross-sector collaboration and shared action. So let's dive in. If you've completed a community needs assessment or implementation plan, you know how much work goes into the process and what a valuable resource they are. They are comprehensive, include so many important data points, strategic priorities, and give voice to the community members and stakeholders you worked with. At the end of the process, we typically get a final published report, which is a great accomplishment, but many of you may know that there can be some drawbacks to having only a printed report or even a PDF as your final product. First, once that document is complete, you can't change it, even if something like a pandemic happens. And perhaps even more frustrating is that oftentimes the document ends up sitting on a shelf and is only really appreciated by a few people. In comparison, a community health dashboard is buildable over time, makes information easy to share, and can be a hub for community action, which is crucial, especially when you can't meet in person. I'll share that I've done this both ways, and I can tell you that having a community health dashboard is really a game changer. Prior to joining HCI, I was a client at the local health department in Orange County, and we used HCI's community health platform to help launch and support our local collaborative efforts. And the platform was such a central piece of our collaborative work because it meant we had one place to share and track data, reports, and activities. We acknowledge that for hospitals and health departments, there are regulatory and accreditation requirements. Some of those are to ensure your assessment includes a range of data, including health and social determinants of health data, actively engage with community residents and partners, track changes or progress over time, and sharing and making these documents widely available. We know that it can be a challenge not only to do all of these things, but also be able to demonstrate it in your reporting. And this is where we think having a dashboard could be an essential tool by keeping your assessment updated, showing changes to your plans, and engaging community partners and members throughout the process. A community health dashboard can be a great starting point for your assessment, and we think it's important to start with meaningful data. One of the first questions we get asked is, how much data do you need, and how do you choose what to include? The answer is unique for each community. HCI's platforms include about 150 standard indicators, with some communities adding indicators and hosting upwards of 300. Our recommended approach for choosing meaningful data is to use indicators that help facilitate cross-sector or multi-department collaborations, track progress over time, and get to root causes of health inequities. We like data that align with state or national initiatives such as Healthy People 2030 because they're more likely to be tracked by multiple organizations and at different levels. We also think it's important to use reliable sources that are regularly published, which helps us track our progress. Finally, we like data that's granular enough to show disparities. We find that this really is what informs local programs and policies. When curating data, it's important to show data across the health equity spectrum. Oftentimes, data focuses on those indicators that are more downstream on the right-hand side of the spectrum, such as mortality, disease, or risk behavior indicators. But because health begins where people live, work, and play, it's also important to have data points that show living conditions, such as overcrowded housing or access to parks. Beyond that, data should address institutional inequities, such as differences in access to healthcare and unemployment. And finally, data should address root causes showing social inequities, such as gender pay gap, poverty, or hate crimes. Utilizing this framework, credible data is available from a variety of government, private, and local sources. These data are typically updated annually or biannually, so whether you're creating your own dashboard or using a vendor, it's important to update the data soon after the source is published so that your dashboard remains current. After you have this data, the next step is to use it to understand and prioritize needs in your community. These are the types of data questions we typically ask ourselves to identify needs in our community. Are we doing better or worse than the state or the US? Are we meeting state or national benchmarks? Are things generally getting better or worse? And finally, which communities are experiencing disparities? A comprehensive community health dashboard should bring those data points together and answer some of those questions. This is an example of a dashboard that shows values for various indicators in one county compared to state and national values, as well as general trends and Healthy People 2030. Having a range of indicators on a dashboard will help you tell a more complete story, including where the community is doing relatively well and where it might be falling behind or trends are worsening. As I mentioned, many of our clients will have a range of 150 to 300 indicators on their dashboard. And then after reviewing this, they might have a smaller set of indicators they're tracking over time for their community health assessment or specific priorities. As you begin to see areas you want to prioritize, your community health dashboard can provide data and data visualizations to help you better understand disparities by demographics such as age, race, ethnicity, or gender. Of course, another way to look at the data is by looking at geographies. Your community health dashboard should also have the ability to map data by city, zip code, or another regional grouping to help show which communities may be more at risk. This is a map of households with internet subscription by census tract. Areas in red and yellow are those with less access compared to state benchmarks, while those in green are doing better. Looking at the map, you can begin to see some patterns emerge about which communities might have disparities in access to internet. And just by the way, this is an example of a topic that maybe a year and a half ago may not have been in a community health assessment, but more recently, we're seeing many of our clients look at internet access as it relates to access to telehealth and health information, ability to work from home, and ability to engage in virtual learning. So as areas of interest or priorities are defined for your assessment, you can build out pages that really begin to tell your data stories from your dashboard. And with a dashboard, you might be able to add priorities or key data points such as this that were not originally in your assessment. Another important part of a meaningful dashboard is trying to look at an issue from multiple perspectives or data points. For instance, you're seeing 3 maps of a county. From left to right, the maps are showing by zip code, adults who are sedentary, adults who are obese, and adults taking medications for high blood pressure compared to state zip codes. From these maps, you can really begin to see that some communities or the same communities that are at higher risk for being sedentary are more likely to have higher rates of obesity and use medications for high blood pressure. And we're not drawing any causal conclusions here, but looking at this data in this way can help you, 1, confirm that the data makes sense, and 2, identify potential action points. So depending on where your community is at in terms of health equity work, you might also go even more upstream and look at education, income, or housing conditions in these areas to identify areas for cross-sector collaborations. Looking at these secondary data sources or data captured by other parties is a great starting point for your community health assessment. But we know that most communities are also doing additional primary data collection to gain deeper insights or build off previous findings. Many health departments are themselves a source of data and may want to add data on reportable diseases, hospitalizations, or vital statistics on their dashboard. This can be very helpful because that data is often more current than secondary sources. Many communities also conduct their own surveys that mirror questions asked by CDC's Behavioral Risk Factor Surveillance Survey, or BRFIS, so that they can get data at a local level. Some communities conduct local surveys so that they can ask questions that aren't in BRFIS or other surveys, but are important to the local community. Whatever you're capturing, once you've completed the data collection, having a community health dashboard can help you put your local data into context with state or national data and help you track your progress over time. There are also often other local reports completed by local agencies, including other hospital CHNAs or topic-specific reports on a range of issues. Your platform can be a great tool for building on your assessment or platform by including those reports. For instance, if one of your priority areas is maternal and infant health, and a local agency just published an in-depth report on substance-exposed infants, you can, with permission of course, link to their report. This really elevates their report as well as better inform your assessment and strategy. I'm going to now hand this off to Emily, who will be showing some examples of how some of our clients have put this all together.
Thank you, Jane. Hello, everyone. I'm excited to show you a variety of content and examples on some of our clients' live sites today. Please keep in mind, I am showing sites that are built using the HCI platform. If you don't currently have something like this in place, you may consider these examples when thinking about building out your own platform or shared site. First, I'm looking at this Milwaukee Healthcare Partnership site. For the purpose of today, however, I'm really going to hone in on the data. Let me click to this general dashboards page. From this page, you can see the variety of access points to different types of data dashboards, as well as ways to search for data by topic, location, or even source, for example. But I really want to focus on a piece that Jane was just referring to, primary data. This community health survey is an example of that. When I click into that community health survey dashboard, I can see information about the community survey itself, how it was an integral part of the primary data collection process in this group's last CHNA. I can see all the indicators that this client is hosting, which were a result of those survey collections. And it's just a really significant way to showcase how important that primary data is when using dashboards. Moving on, I want to show you quickly a dashboard that I actually built myself, where I combined some of those community survey indicators we were just looking at with some other indicators from secondary data sources such as CDC Burfus, American Community Survey, etc. And I did this around a specific topic that I wanted to look at. For this one, I chose access to health services. It's not only important, but helpful to begin the process of synthesizing the primary and secondary data in order to get a comprehensive look at what the data says around a specific topic. Let me now segue to the next site I want to showcase for ways to tell a story through data. Here's a local report on living in poverty. It was built on our site using a report builder tool that pulls in selected data and custom content to create a sort of one-page visual. This is an easy to read, simple report that uses data visualization to tell a story around a specific topic, as we see here on poverty in a specific county. Consider adding the ability to have a report like this and link to the data so that it will continue to stay updated. Additionally, also consider making this type of report downloadable or exportable, as you can see we can do here, so that one may use it externally for various reporting purposes off of a site. Moving on to another site I want to show you. Using data to also tell a story a bit differently here is this Baton Rouge site. Here I'm looking at a page focused on Black Lives Matter, which is very important to this community. Another great thing about utilizing these platforms is to tell a story in the way that it's able to distill a very complex issue such as this one into one simple message or story. And then bringing in data, as we can see here over on the right-hand side, to really support that messaging. Consider how you can make this more interactive with the data elements to see more details and context on a specific indicator. I can do that by clicking on one of those and opening it here. This will really help bring context to the issue. Finally, I want to share one more site called Hope Rising. Here is yet another example of how a client has utilized the platform with data to communicate important work in their community. They are using it to simplify and summarize these key points from their needs assessment. This is technically referred to as what we call an electronic CHNA. It's really allowing a user to easily understand the findings, priorities, and data that came out of this process without paging through sometimes up to a 90-page report. It's important to consider all audiences when communicating your assessment outwards. Even within their priorities, which I see up here at the top, I can click in and learn more about that specific priority. I can see more information around the issue, including key facts and data points. It really allows me to understand why this is a significant issue in this community. With that, I will turn it back over to Jane to begin talking about community partnerships.
Thank you so much, Emily. As we discussed in part one of this series, health equity is something that's really become central to our work, as I'm guessing it might be to yours as well. And I think part of that is the acknowledgement that to truly improve community health, we must engage with community partners, including those from sectors that work outside of health on issues such as racism, poverty, housing, and education. In its call to action for Public Health 3.0, the National Association for City and County Health Officials reiterated the call for cross-sector collaborations, shared data, and a collective impact approach. But it can often be challenging to figure out just how to do this successfully. We'd like to take a moment to ask you to think about one organization or sector that's critical for your organization to engage with in the next 5 years. Feel free to type this in chat if you'd like, or just keep that partner in mind. Great. Hopefully you have this partner in mind. As you're thinking about that potential partner, consider what it might take to build that bridge for collaboration. Many of you have probably heard of or used the collective impact approach, which is a model for different sectors to work together on a common agenda or on a specific problem. As you're considering your potential partner, you're probably already thinking about how you can put some of these elements in place: a common agenda, shared measurement systems, mutually reinforcing activities, communication, and infrastructure. You're probably also seeing that a community health dashboard could be a way to build a bridge for collaboration and support these key elements, including the ability to demonstrate shared priorities and common goals, use common data for measurement, amplify mutually reinforcing activities, and act as a hub for your infrastructure and communication. If your dashboard includes both health and social determinants of health data, such as income, education, housing, you will already have some common data for a range of partners to use. Having a shared dashboard also makes it so much easier and, frankly, more fun to share data. If you're a hospital that has prioritized chronic disease in your plan and you're hoping to partner with maybe a food pantry, you might send a link to a page with these maps to begin a conversation. The map on the left shows hospitalizations due to diabetes, and the maps on the right show HCI's food insecurity index, where the darker green shows areas of increased food insecurity. If you don't have HCI's platform, you might share another measure like families living below poverty. This might be the beginning of a great conversation about how these issues are linked and how you can work together towards shared priorities. Once you have your priorities stated, your platform is a great place to organize and communicate data and data visualizations about those priorities, calls to action, shared work that's already taking place or that you're hoping to happen soon, and the progress that you've made together. I'm going to now turn it back over to Emily to show some of the ways that our clients have translated their platforms into shared action.
Great, thank you, Jane, again. I want to acknowledge just once again that I'm sharing HCI platforms, many of which have been around for some time. But once more, we hope you will consider these examples to inspire your own work around a shared site. So here I'm showing a site run by a collaborative who has truly succeeded at building a collective impact model, and they're utilizing the platform as a hub for that work. This page I'm on now is focused on just one of their multiple community initiatives, as you can see the full list here. And this one is for a single city in their region. It's led by a coalition of partners, and they're utilizing this page to communicate their mission, their vision, information about their membership, how one might get involved, and their existing partners. Further down, I can see they're sharing photos of their work efforts in the community. They're hosting a calendar for events. Obviously, with the pandemic, events are scarce right now. Then further down, I can see their current priority areas, and not just a list of them, but information about each priority, and I can gain insights. They're even using photos to bring it home and make it more interesting to view. The data points to really support and lend in more insight into why this is an important issue. And of course, at the very bottom here, I want to just show how they're sharing resources, whether it be reports or other external tools. A great way to utilize a shared space to communicate. Moving on to another site, also utilizing a platform to engage partners in their work, is this community initiative led by a health improvement partnership. They have identified social determinants of health as one of their priorities through their community health assessment. And this page really goes into why it's a significant topic for their community. It shows the why is this important, why it's a priority area, the goals and objectives, and key data points around social determinants in this community. One of the nice things about having a shared platform is that the partners are able to show updates, including reports and other related activities around a specific topic of interest, as we can see here. They're even using it to share contact information about specific work groups or those leading the charge so that others can get involved in this type of work. My last example to show you happens to be a site organized through a large health system. But as you can see, they've created pages that have a very local and community-driven feel. It was really important to them for each region within their expansive network to have its own place to not just share, but access things like local events, news updates, resources. Scrolling further down, they're sharing the priority areas for this region based on their needs assessment. And of course, the activities in their priority areas, what they're doing about it, their goals, and the data that supports the goals and activities around those priorities. Again, a really great way to use the platform to engage with partners and your community as a whole. So with that, I will stop sharing and turn it back over to Jane to start to wrap up our presentation for today.
Thank you so much, Emily. To close, we did want to share one story that we think truly demonstrates how having a community health platform can result in action. This is a story about United Way of Southampton Roads, who used their platform to identify a 23-year life expectancy gap in 2 adjacent census tracts and a host of other issues impacting health, including housing, food insecurity, and mental illness. Using that data, the city secured a $30 million grant from U.S. Housing and Urban Development for a redevelopment project that involved the health department and hospitals, businesses, community-based organizations, and others. And in their words, having the platform was a cornerstone of their work, providing their community common language and data that they could act on. We wanted to leave you today with some of the lessons we've gleaned from supporting community health dashboards over the years. First, having data on a central platform makes it much easier to collaborate across sectors. When data on health, education, income, housing are all in a centralized location, it helps partners find common data to work on together. Since most people are not experts in data, make sure your dashboard uses simple data visualizations that can help tell the stories behind the data. It's important to link data to action by allowing local partners to find local reports and resources alongside their data or the data. And finally, we find that though there's a lot of interest in this work, there's sometimes still a gap in expertise. So you might need to invite experts who can provide technical assistance or build capacity around stakeholder engagement and strategy development. This could be done through a vendor, or you might trade services with a local partner agency that has experience in this area. So that actually concludes our presentation and will lead us into a discussion portion of the webinar. Please feel free to ask any questions in chat or Q&A. As you're thinking about or typing in any questions, I'll invite you to join us for the final webinar of our series, which will take place in 2 weeks on March 25th, and focus on how to effectively develop and track your community health strategies. Zach will be posting the registration link in chat for those who haven't yet registered. Thank you, Zach. And actually for this part of the webinar, I think Emily and I will turn our cameras back on so that we can have a conversation. So Zach, as we're doing that, do you have any questions that may have come in?
Hi, sorry, finding my way off of mute there. Yes, thank you both for all the wonderful content that you've just shared. Just a wealth of information, really. It looks like there has been some questions that have been coming in. And the first one that I've got here is, how long does it take to build a dashboard like this?
I think I can try to answer that question. Coming from the local health department, we actually had looked at kind of this platform and how long it would take for us. So I think some of this really depends on what your setup is, what your starting point is, what your IT department might look like. When I was in Orange County, we had kind of looked at how long it would take, and our IT department gave us an estimate if we were to build this from the ground up, something like 8 to 12 months. So that would be, you know, having no specs at all, having to enter all the data and figure out what data elements we wanted and the data visualizations. But again, I think that can really depending on your local resources. HCI's platform. So if you can choose to use a vendor like HCI, we typically work with the clients and get their dashboards up around 12 to 14 weeks. That can be extended if you know, you're working on branding or other things with community partners, so you may not be quite ready to make that public in that time. But sorry, that was a long way to say it kind of depends. We do it around 12 to 14 weeks, but it can depend on your local context. Hope that answers the question.
I believe so. Thank you, Jane. It looks like we do have another question related to the platform and funding. Do you have some examples of how platforms like these are funded?
Emily, do you want to take that one?
I can take that one. You know, it really depends. We've seen over time a large variety of approaches, and I think it depends on the community and who the partners are and the resources from those different partnering organizations. You know, some clients have been successful in getting grants to support their platform, even if that's just temporary. Another successful way we've seen is clients have a shared approach where multiple partners are financing. And then some tend to have sort of a backbone or lead agency who is the financial supporter, while the other partners have provided their support in staffing or other types of resources like data support, for example. So I think it really depends on the community and the different types of partners that have come together for that specific platform.
Great, thank you, Emily. There is another question relating to the data on the HCI platform. Do you know who maintains the data on the platform and maybe how regularly it might be updated?
Sorry, I was trying to unmute myself. I can take that one too. We have a dedicated research team who maintains all the data across our sites. And then we work to update the data on platforms as soon as the data source publishes new data. So that just varies depending on the data sources. And our clients also have the ability to upload and maintain their own indicators if they choose to do so. So that is just another piece of the data dashboards.
Wonderful. There is another question. How does the eCHNA meet the needs for 501c3 hospitals?
That's a good question, Jane. I don't know if you have anything to add, but they would, you know, still would need to create and write a full report to meet those requirements. But having the report, you know, accessible and publicly available on the site, like I showed, in sort of an electronic version, is just another way to promote the report and all the work that went into it, and also just make it easily digestible for community members or partners and stakeholders. It's also a great way to bring everyone to one spot where they can leverage those findings and all the shared data there to really take more collaborative action on the priorities that they've chosen to focus on.
Yeah, no, I don't have anything to add. I know we have here with us Tracy Van, who's from our team, who had worked in community benefit for a number of years. I don't know if Tracy, if you'd like to share any insights on that.
Hey everybody, sorry about that. I'm trying to get myself off mute. I think Emily covered it. I mean, with the With the 501c3, you have to make sure that you've got, as we said, the community health needs assessment has to be completed, and then it has to be approved by and adopted by an authorized body of the hospital, governing body. But the key is you can have that document that's available for the to meet the IRS requirements, but this is then taking that a different step, a further step where you're actually making it where you can interact with it and you can get more people involved with it. And as you get into the posting the data electronically, you can also think about your implementation strategy and how you can continually update information that's coming in about the outcomes, because then as you go through your next CHNA cycle, you're going to want to make sure that you talk about what's the impact that you've been doing since your prior CHNA. So it all kind of ties in together. So I think that you can have both. You have a set document that you can send out to meet those standard requirements, but then this is taking it to that next level for engagement.
Yeah, thanks so much, Tracy. And though it wasn't asked, I'll say kind of it's very similar for health departments. If they're going through accreditation, there's requirements to have a range of data and also to kind of build off their assessments between the big CHNAs. So making sure to gain deeper insights about health and social determinants of health, as well as tracking their community health improvement plans. So when I was in that role, it was really helpful to just have something that we could continue to update so our community partners also knew what was going on. And then when it came time to do the reports, there was a really clear track record of doing some of that work, but also communicating it with community partners, which I think is quite an important element of community health planning. Were there any other questions, Zach?
Thanks, Jane. It looks like all the questions that have come in today have just about wrapped up. Thank you so much for those of you who have been engaging with us via the chat and Q&A box. We, of course, want to be conscientious of everyone's busy schedules. For those of you interested in our final part to this webinar series, as Jane mentioned, I put the registration link in the chat box, so feel free to access it there. We've also put our main contact email on the slide here if you have any questions on how we may be able to support you and your organization. And for our current clients in attendance, please feel free to reach out in your account to your account manager or project manager if you have any questions following today's webinar. And thank you again, everyone, for joining us today. Thank you again to our speakers for that wonderful presentation. And that concludes today's webinar. Have a great rest of your day.
Thank you so much.
Thanks, everyone.